Assalamualaikum warahmatullahi wabarakatuh. My name is Sultan A. Today I will present about Neoplasm. First, I will explain about characteristics of benign and malignant tumors. Benign and malignant tumors can be distinguished from one another based on the degrees of differentiation, rate growth, local invasiveness, and distance spread. Benign tumors resemble the tissues of origin and are well differentiated. Malignant tumors are poorly or completely undifferentiated or anaplastic. Benign tumors tend to be slow growing, whereas the malignant tumors are generally grow faster. Benign tumors are well circumscribed and have a capsule. Malignant tumors are poorly circumscribed and invade the surrounding normal tissues. Benign tumors remain localized to the site of origin, whereas the malignant tumors are local invasive and metastase to distant sites. The next point is etiology of cancer. Predisposition factor of cancer. There are environmental factors, age, acquired predisposition condition, interaction between environmental and genetic factors. There are classes of carcinogenic agents that have been identified. One is chemical, two is radiant energy, and three is microbial products. The next point is hallmark of cancer. There are self-sufficiency in growth signal, intense sensitivity to growth inhibitory signal, altered cellular metabolism, evasion of apoptosis, limitless replicative potential or immortality, sustained angiogenesis, invasion and metastasis, evasion of immune surveillance. The next point is diagnosis of cancer. Several sampling approaches are available, including excision of biopsy, fine needle aspiration, and cytologic smear. The next point is grading and staging. Grading of tumor is determined by cytologic appearance and is based on the idea that behavior and differentiation are related, with poorly differentiated tumor having more aggressive behavior. Staging. Extent of tumor, determined by surgical exploration or imaging, is based on site, local and regional lymph node spread, and distant metastasis. Staging is of greater clinical value than grading. The classification used to the TNN system: T for primary tumor, N for regional lymph node involvement, and M for metastasis. TNM staging varies for specific form of cancer, but there are general principles. T0 is used to indicate an in situ lesion, whereas T1 to T4 is used to indicate primary lesion based on increasing size. N0 means no nodal involvement, whereas N1 to N3 would denote involvement of an increasing number and range of nodes. M0 signifies no distant metastasis, whereas M1 or sometimes M2 reflect the present and estimated number of metastases. The last point is treatment. A benign tumor can usually be treated with surgery, although some may be treated with radiation therapy or chemotherapy. Some benign tumors are not treated as they are not posing any health risk. Malignant tumors may require chemotherapy, radiation therapy, or immunotherapy medication to eliminate a tumor cell that still remain after the treatment, or to treat secondary tumor present at the other parts of the body. I think that's enough. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.